Today I wanted to just review how to do a Medicare wellness visit. So one important thing to note, so that billing is appropriate, the visit type should be chosen as the Medicare preventive visit type. That really does nothing except choose the right code in terms of billing. Down here in the additional manage, I'm going to clear that. And in this HPI list, there is a Medicare preventive visit type, and I wanted to show you how this works. So there it is, Medicare preventive. And when you choose this as the HPI, it basically walks you through the various portions of a Medicare wellness visit. So if you click on this, you can choose if it's the Welcome to Medicare visit, that's the first one, an annual wellness visit, or subsequent. This patient doesn't really have Medicare, so let's just pretend that this is an annual wellness visit. I'm going to collapse all of these panels so you can see what's in the Medicare wellness visit, vital signs, depression screening, cognitive, functional ability, which includes a get up and go, nutrition, substance use, a review of systems, and a history. So I'm going to expand them all. Again, in the vitals, you still have the same ability to look at history of vital signs, graph them as well. Your visual acuity is right there. We don't have a hearing screen here at present, but should we have that, it could be seen here in the vital signs. A depression screening, you can also click here and get a geriatric depression scale. You can also access the PHQ-9 from screenings as well. The cognitive assessment is the SLUMS, the St. Louis Mental Status Exam. And you guys are probably familiar with that. It will list the various scores if this is a subsequent wellness visit, so you can compare what the score was the previous year. Functional ability, important questions about falls, and some safety questions as well. There is a fall risk plan here if you wanted to develop that with your patient. The get up and go, like I said, is right there. One important thing to note, and this isn't specific to the Medicare wellness visit, is this little symbol. If you click on that, you can find out why this is important for various reporting measures. So that's the functional ability. Nutrition, pretty self-explanatory. Tobacco, vaping, and alcohol. I'm going to click on this detail for alcohol, and it will pull in what was entered during intake. Review of systems, pretty similar to what we recognize. And then history, this is kind of the history tab in a different format, but past medical, interim, we don't use often, but in the history tabs, if you wanted to document an ER visit or a hospitalization, that would be done through the interim history bar, and that information would show here. Social history, lifestyle, occupation, and if you wanted to go into any of those in particular, you could go into add. A little plug here, this is a social determinants of health link, and I'm going to click on that. And a lot of great information here. including some alcohol questions as well, and exposure to violence. This is confidential. So I'm going to close that. And then once you've done this Medicare HPI, that basically is the visit. However, if you do want to do a physical exam, which is not part of the wellness visit, you can proceed as usual. And then one thing I wanted to show you, we'll take this off because I was doing that for something else. So let's just put in the wellness visit code. So let's see, I think if I say, yep, you can use IMO to find exactly what you need. So Medicare wellness visit initial. And I wanted to show you that the nice thing, if you've picked the visit type as Medicare preventive, when you go to finalize, and calculate the code, it will come up with the correct G code. Voila. So if you have any questions about the Medicare preventive template, please email us at nextgenhelp@greaterportlandhealth.org. Take care.